So, Dr. Al-Jewair, thanks for saving some time to talk to me about your paper coming out in JDE. It was a survey of inappropriate behavior. So, what I wanted to ask is, what was your inspiration to study inappropriate behavior, and what did you learn from this? What did you learn from engaging in this research?
Well, first of all, Dr. Nalia, I want to say thank you for inviting me to do this short podcast with you. This project is obviously, as you read, is related to mitigating workplace violence in academic settings. Dental learning environments are often high stress for students, which could also exacerbate or increase the risk of adverse patient-provider interactions. So what we've done recently is that we conducted a survey with our students, faculty, and staff to explore this topic a little bit further. And what we found is that the prevalence of workplace violence was fairly low. I think it was less than 10%, which falls within this national range, although it's a wide range, as I mentioned earlier. And what we found also is that most incidents occurred in or within the dental clinic and involved verbal aggression, or how individuals responded to these incidents, or how they managed them. So when incidents occurred, students often chose not to act, walk away, or confided in peers without documenting the events in the electronic health record or reporting it to their faculty. And those that documented the incidents, often those reports or documentations lacked the specifics as to what exactly had happened and what occurred and how they managed the situation in real time. In addition, our survey noted that most respondents were unaware of protocols or designated personnel to report such incidents to. And I think this lack of action and awareness had allowed for inappropriate patient behavior to persist and remain unaddressed, obviously creating an unsafe learning environment. Workplace violence does negatively impact students' performance. It impacts their mental health, their academic progress, and their overall programmatic performance. So what we wanted to do is to create a protocol that would provide a standardized and decision-making model that help us tackle and mitigate workplace violence in our dental clinical learning environments and be able to hopefully foster a supportive environment for our dental community, ensuring that they focus on their education and professional development without the added stress of unaddressed workplace violence. To consider shared governance when developing and implementing the protocol. You need input from various stakeholders for this protocol to be successful and for people to feel comfortable implementing it and reporting these conditions and being able to respond to them in a timely and effective manner. Another thing we've learned is that for a successful protocol to be implemented, it really must align with the policies and procedures of the parent institution.
People in my role, like I talk to clinic deans all the time, and people in my role, we kind of have this sense without any data that these kinds of incidents increased with COVID. Do you have any data, or do you share that opinion? What do you think? Because you're sort of an expert now in this space.
COVID certainly added stress to the interactions and added a level of complexity to the issue. However, I don't think we have the data, at least from our institution, to say that COVID contributed significantly to the rise in workplace violence in our institution. You got to remember that this topic involves, or the etiology of workplace violence is multifactorial. It could be related to the heightened emotional state of the patient. It could be related to the high stress levels of the provider and their lack of training and communication skills. And it could be related to the fact that or to the organization itself. I mean, understaffing and the shortage in allied dental health staff is a fact that many institutions and organizations are struggling with. So that's, again, adding to the stress level that people are experiencing when managing healthcare settings. So I'm not sure if I could say COVID is a reason, but it certainly is a contributing factor. But I think the topic is multifactorial, and we need to keep that in mind.
Great. Well, thank you. Thanks for your time. Have a great rest of your week in Buffalo.